Yes, hi. Let me just share my camera. I just have to rearrange my laptop. Thank you, everybody. Thank you so much, Miss Noki Wilson, for putting this together. It's always a joy to be a part of this town hall. Let me just make sure I turn on my camera here for you guys. All right, there we go. And all right, thank you. Sorry for that delay. And so I'm hoping to provide an update on a few things, just in brief, where we currently are with the Navajo Nation and with Chinle Service Unit. And then also give you some highlights in regards to like where we are with the vaccine effort. And I'll just mention briefly, Omicron and what that means to our public health response, and what we can do to protect our friends and families. And so overall, this is the Navajo Nation. The take-home message here is that you see the Navajo Nation is in this sort of like light red, and then you've got like the four-corner region. CDC has listed the threshold as 100 cases per capita per 100,000 people as high, transmission's high. And so here our case rate is 264 cases for every 100,000 individuals. Over the last 7 days is 264. There were 419 cases reported in the last 7 days. This is ending last week on Thursday, Thanksgiving. And so this is likely an underestimate of what is actually happening due to reporting delays. But we know transmission is high. We also know that test positivity is high. It supports the fact that cases are indeed high at this time. We continue to do about 1,000 average daily tests in the last 7 days. And of note, hospital capacity is under stress. Hospital beds are 62% full, and ICU beds are 96% full. And this goes across Navajo Nation. And our public health capacity in regards to contact tracers, we like this ratio to be 5. Right now, it's been toggling between 1 and 2. And so we know that our resources and staff are under tremendous work at this time. Next, please. And so here's Chinle. So Chinle is also very similar to what the Navajo Nation is experiencing. We are in this third wave or third surge, and we continue to be high. Our case rate went from 336 to 271 per 100,000 people. We had 91 cases in this past 7 days in this reporting period, of which half are breakthrough cases. Next, please. And so similarly, our cases are going up. Our hospitalizations are ticking up slightly, but it has not reached the same heights as the first 2 surges. And so we're monitoring that closely. Similarly, with deaths, we know that this is a delayed effect, and that has not reached the same heights of the first 2 surges either, but we continue to monitor this. Next, please. And so this is important. The Navajo Nation puts out these high-risk chapters where the way the chapters are identified is if for 2 weeks in a row, their case rates are at high transmission. And so that's more than 100 cases for every 100,000 population, even though we understand that chapters are indeed small. And so with that being said, I'm going to bring your attention to the red column. Here are our high-risk chapters that have been on this list for more than 6 weeks. They include Chinle, Pinyon, and Cottonwood. And so these chapters have been hot for quite some time right now, and they continue to do that. Next, please. And so our test positivity is also high, 13%. The threshold here is 10%, and we've been above 10% for a few weeks now. Next, please. And so if you haven't heard already, like right now, the surge on Navajo Nation and in Chinle is driven by Delta. All the samples that have been sequenced to date have come back Delta. Next, please. And so what does this all mean? It means that we continue to be at high transmission for Chinle Service Unit as well as Navajo Nation. And so for situational awareness, our risk remains high. Next, please. And so this is also of note, we have been monitoring the United States as well. And so community transmission across the United States have continued to be in high transmission. We're seeing some areas starting to cool off while other areas are getting hotter and hotter. But it's just regional shifts in transmission. Next, please. And this is how they are tracking vaccination progress by county. The way this is calculated is looking at vaccine rates, but for the U.S. Census population. And so regionally, we know that we have higher vaccine rates than other parts in the United States, but we remain in a Delta surge with high case rates. Next, please. All right, so where are we in terms of our vaccine efforts? For Navajo Nation residents only, there were 108,541 individuals that are now fully vaccinated. That is 50% of the total population ages 0 and older, and 71% of the total eligible population 12 years and older. This will soon be reported for 5 years and older once those numbers start to come in. Next, please. For Chinle, we have 21,203 community members that reside in Chinle Service Unit that are now fully vaccinated. That is 65% of our total population, 85% of our population 12 years and older. Next, please. And so I wanted to share this graph with you because I think it's important to understand by age group and where we still need some level of targeting. And so the blue columns represent fully vaccinated. The orange columns represent partially vaccinated. And what you see here is that, we ages 5 to 11, we have started, I believe, about 1,100 kids ages 5 to 11 have already received their first dose of Pfizer. And within the few weeks, this week and next week, we hope to see this age group, this population, receive their second dose of Pfizer. And so that is exciting news. Next, please. For flu. And so, of course, we want to make sure our population is fully protected. And so we're tracking flu vaccination efforts as well. This is about a week and a half old, but, as what it states is that, 12,000, likely it's more now, 12,189 individuals have been vaccinated against the flu. That's 38% of our population. We'll continue to trend this and use this information to target needed areas. Next, please. Okay, so a brief word on Omicron. So, what is this Omicron variant? I just wanted to let everyone on this call know, and hopefully you can share it with others as well, is that this variant is a completely different variant from other prior variants, including Delta. So it's very different than Delta. And the reason why it's been labeled a variant of concern by the World Health Organization is because there are epidemiological evidence that it has it can have a potential impact on transmission and maybe even on our current vaccines and treatment. It has a large number of mutations, that, more than we've seen before. The first case was detected in South Africa, and then it was picked up on their surveillance system. And they investigated an outbreak among young, healthy adults, university students. And so what we also know is that Omicron is causing disease in people. In South Africa has already gone through their Delta surge. And so what we know is that right now it's causing disease in people in an area that's already gone through a Delta surge with 60 to 70% of the population with prior COVID-19 infection. And I just highlight that because it tells us that, very similar to Delta, a prior infection is not as protective as a vaccine-induced protection. And what I mean by that is that even with Delta, we know that someone with a prior COVID-19 infection is at about 5 to 6 times higher risk than someone with a vaccine-induced immunity to get reinfected. And so vaccines still play a large and key role in Delta and even in Omicron, and it is expected to continue to provide that level of protection. The other piece to note here is that, of course, things are still evolving, right? There's still a lot of questions about transmission. We know it's highly transmissible, similar to Delta, but we don't know yet if it can outcompete Delta in terms of taking a hold on a population and running through the population. We also don't really know yet in regards to, like, does it cause more severe disease? We don't know. We do suspect that the vaccines are protective, but to what degree is still unclear. And similarly, how will this impact treatment? I know there's a lot of chatter out there about treatment, but really the data is not there yet and still evolving. So we'll continue to track that. Also of note, it's already been detected in multiple countries, including here in the United States. Our first case was detected in California in a traveler from South Africa. Next, please. Yes, and so one thing I did not mention here is that our current testing capacity, our current tests, the ones that we use for diagnostics tests, can pick up on this variant. Next, please. And so what does this mean in regards to our public health response and what the community should be doing? Does it change anything? No, it doesn't. What it means, though, is that it underscores key strategies and efforts. And so what that means on our part is that we will continue to have strong surveillance so that we use data, we monitor data to understand what's happening, and that includes epidemiological data. And luckily here in Navajo Nation, they also have their, strain surveillance system as well. And so that has already been made a priority to detect Omicron here in Navajo Nation. Similarly, both to fight Delta and Omicron, vaccination and boosters are key. If anything, this really underscores boosters, and I'm going to speak a little bit more to that. In addition to all of this, we also know that hospitalizations are really filling up, and those resources are limited. And so test and treat. We are underscoring that, meaning testing early, anybody vaccinated or unvaccinated, you have symptoms, test, because in our ability to treat, there's a small window to treatment. And so making sure that individuals test early when they're symptomatic, regardless of vaccine status, and then connecting them to treatment is going to be very key in preventing hospitalizations and severe illness and death. Also, COVID-19 is airborne. These variants are also airborne. So masking and ventilation remains critical. Having a good mask with fit infiltration, and then understanding ventilation and air movement, whether that's indoors or outdoors. Next, please. And so why are booster shots important? So some stats, of all the people we've vaccinated, and this is here at Navajo Nation that we've been monitoring, 2 to 3% have experienced a breakthrough infection. But we also know that protection wanes over time, leading to an increase in breakthrough COVID-19 infections. And that's why you're hearing, like, of all the cases that are coming in, why is it that 30 to 40% of those cases are breakthrough infections? It's because of this. It's protection wanes over time. And what we do know, based on our data, is that most of those folks that are experiencing breakthrough infection is because they're about 6 months out from completing their Pfizer Moderna series, or 2 months out from completing their Johnson & Johnson series. And that's why boosters are so critical. And that's why this also remains the best way to protect against severe disease. And so if you go up one more slide, Ryan. Oh, sorry, back. I just want to show one thing, back. So if you look at this image, and I did borrow this from NCI, is that you have the coronavirus here, that circle with the spike protein, and then you have the human cell at the bottom. And then the coronavirus tries to attack your cells, right? It tries to land on your cells and that's where it can cause harm. And so when you have a vaccine, the vaccine teaches the body to create these antibodies. It creates these antibodies that can recognize the virus, attach to the virus because they see and recognize it, and so that the virus never attacks you. Next slide, please. So what does the booster do? What the booster does is that it ramps up your response, your body's ability to recognize coronavirus and protect you from the severe illness of coronavirus by recognizing this virus from multiple vantage points. So imagine seeing the virus and your previous vaccine can only recognize 1 to 2 spots. The booster then teaches the body to ramp that up, and now you can see it from 10 different ways. And so it can recognize it from multiple vantage points so that it doesn't attack to the body cell. and cause harm. And so, I'm hoping that this information can be shared with those on the call today and to the community members, because even we're in Delta now. And even if Omicron were to get here and able to outcompete Delta and cause high transmission, both with Delta and Omicron, vaccines and boosters are going to be very critical. Thank you. Oh, I'm sorry. So last thing, all adults 18 years or older are eligible for a booster as long as they've completed the Moderna or Pfizer vaccine 6 months ago or Johnson & Johnson vaccine 2 months ago, but all adults. Thank you.
Okay, Dr. Ball, thank you so much, Terry, for that very important information, underscoring how we need to continue to protect ourselves. So next we have our fearless leader, our clinical director, Dr. Eric Ritchie, who I like to call my son as well. So Dr. Ritchie, give us a clinical update, please.
Yeah, hi, good afternoon, everyone, and thank you for joining our town hall today. For those of you that don't know me, I'm Dr. Eric Ritchie, and I'm the clinical director here at Chinle Hospital. And I'm going to give you a little bit of an update on some of our clinical services COVID-19 operations, just so you have an idea of what to expect when you come to our facility. And what I'm also going to include in here is some updates to our testing plans, as well as some updates on where you can receive COVID-19 vaccinations and boosters that Dr. Voss spoke about just a moment ago. So if you've been to Chinle Hospital recently, you know that the first step in seeking treatment or care here is still going to be screening for symptoms of COVID-19 at the door. And that's still very important for those of you that are coming into the facility to make sure that we're keeping everyone here safe. We do believe that with screening for symptoms and exposure to COVID-19 and universal masking within our facilities, that it is safe to seek even routine healthcare here. And so even as you look at some of the numbers Dr. Va presented that are showing very high rates of transmission in the community, we still are open to serve your healthcare needs here in person in our facilities, and would encourage you and your families and community members not to delay essential healthcare services just because of the level of community transmission of COVID that's happening right now. It is safe for you to come here and see your PCP, to get updated on your cancer screening, and to seek that other kind of healthcare that people may have delayed or deferred back in 2020. So all those services are still open to serve you. The other aspect of our COVID-19 operations here at Chinle is testing for COVID-19. And I'm happy to say that we're continuing to provide very high volumes of testing to the community. In many ways, testing here at our drive-through testing locations, Chinle, Sigley, and Pinion, is vastly more accessible and more convenient than what you're going to find at testing facilities in the private sector. I can tell you from personal experience, my parents and relatives that live in Florida have to drive miles to get tested and often have to wait long lines. And here, I can get my family members tested within a matter of minutes. It's really not difficult at all. We have updated our testing strategy a little bit with increasing transmission of the coronavirus, both here in Chinle and nationwide. We are seeing higher demand for testing resources nationally, and that's straining our supply chain of test kits a little bit. So earlier on this year in July and August through some of the summer and fall months, we had more than enough test supply to be able to do rapid COVID tests on everybody that came to our doorstep. But a couple of things have happened since then. The number of tests that we're doing each day has increased dramatically, and the demand for those test kits has increased nationally. And as a result, we're not able to get our hands on enough test kits to do a rapid in-house test on everyone that comes to our doorstep looking for testing. So similar to what's happened during other times in the pandemic, we've got to make some strategic decisions about who needs a rapid test today and who might get a send-out test that will come back in a few days. And so for the most part, if you're coming to our facility seeking testing and you're asymptomatic and just want to get tested, you may be offered a send-out test that'll be back in a few days. Whereas those people that are having acute symptoms of COVID that need to know right away will still have access to a rapid in-house test. In addition, we've begun offering home self-test kits to people that come to our drive-through seeking testing. So if you don't want to wait a few days for a LabCorp test to come back, you can get a quick and convenient home test kit and test yourself. Those test kits are now available over the counter at many commercial pharmacies. We're distributing them for free here at our testing facilities. And so if you come to any of our test sites and ask for a home self-test kit, you can get one and you can test yourself at home without having to deal with the nose swab that goes way up in the back of the nose and is kind of super painful and inconvenient. So if you're interested in those home test kits, they're being distributed at all of our test sites. I've done them myself a number of times. They're very quick and easy to do, and you get a result within 15 minutes. So if you're somebody that's in that category of an asymptomatic patient that maybe has had a possible exposure, and you just want to quickly know if you're positive or negative, come to our drive-through, ask for one of those home test kits. They're really easy to do, and you'll have results in 15 minutes or less. So those are the updates with regard to COVID-19 testing. The other area where we're engaged in some unique COVID-19 operations is around treatment for the virus. And as you know, access to treatments for COVID-19 has vastly improved over the course of the pandemic. Vaccines are still our first and most important line of defense against the virus. And I'm going to talk about that in a little bit. But in the event that you or a family member does get infected with the virus, there are treatment options available that weren't available in the early stages of the pandemic. And that includes IV infusions of antibodies against the virus for patients that have symptoms of COVID-19. You can be eligible for an IV infusion of antibodies. We generally offer those treatments right at the point of care. When you find out you have a positive test result, we'll offer you the opportunity to get an antibody infusion here in our hospital. We have a special lane where patients come into and park, and a special entrance for them to come in, quickly get those infusions and leave. We do anywhere from 10 to 12 of those infusions a day. We've done more infusions here at Chinle than really any other IHS facility because we've been so aggressive about making this treatment available to anyone that has symptoms and tests positive for the virus. That treatment is most effective early in the course of illness. So I'd advise you, if you know someone that has COVID, that's recently tested positive and has symptoms, they shouldn't wait to get treated. They should come in and get treated as soon as possible. You may have seen in the news about new oral medications for COVID-19 that are starting to be authorized. At this point, none of those medications have been authorized for emergency use by the FDA. We're still waiting for that authorization and waiting to find out more about whether we'll be able to get some of those medications in stock. So those oral medications are not available here at our facilities just yet, and it'll be to be determined which populations will benefit the most from those oral medications versus the IV infusions of antibodies that we're using right now that have been very effective at keeping patients out of the hospital. Speaking of the hospital, you heard from Dr. Va that hospital capacity is starting to become an issue at some of our facilities. I'm happy to report that here at Chinle Hospital, we have been doing our best to secure enough nursing and medical staff to keep our hospital beds open and not fill up to the point that we can't take new patients. So we do still have hospital capacity available here locally to treat both patients with COVID-19 and patients that need to be admitted for a non-COVID diagnosis. If you came into the hospital as an inpatient during 2020, you may be familiar with our respiratory care unit, which was a dedicated wing of the hospital that we converted from our pediatric care unit to an inpatient unit that only served COVID patients. During this wave of the pandemic, we have been seeing far fewer hospitalizations for COVID-19 than what we saw during earlier waves. And a lot of that is a testament to the effectiveness of vaccines and the effectiveness of treatments that we have to offer outpatients to prevent them from getting hospitalized with COVID. So while we are still seeing some patients in the hospital with COVID-19, it's not as many as it was before, and many of those patients are having a much milder course of illness if they've been fully vaccinated. That's important because it means that we don't have to dedicate as much space and personnel within our hospital solely to the treatment of COVID-19. So for this winter, our goal is maximum flexibility in our hospital. We want to be able to accommodate both waves of COVID infection as well as flu and RSV and some of the other conditions that we typically see during the winter months. So at this point, we do still have hospital capacity available. We're working very hard to make sure we have enough of that to meet the needs of everyone. The biggest area where our hospital is being stressed is in people that need specialized inpatient hospital care off the reservation. So think about the patient that needs dialysis or the patient that needs a heart catheterization. Those are procedures that we can't offer here at Chinle Hospital. And so patients usually have to go to a hospital off the reservation to get that kind of care. Fortunately, in the large metro areas where we transfer our patients to, they have not achieved the same level of vaccination coverage that we have here in Chinle. And so their hospital systems are being stressed by more COVID-19 hospitalizations, and their hospital capacity is really limited. And so what we're starting to see is patients that need to fly out to other facilities are experiencing longer waits in our emergency department for an available bed. And then when we do find one, those beds might be further away than where we would typically send patients. So while you might have experienced yourself or a family or loved one being transferred to Flagstaff or Albuquerque in the past, some of our patients are now being transferred as far away as Las Vegas or California or Texas to find the services that they need and make sure they can get the care they need. At this point, that issue is it's difficult. It hasn't reached a crisis or a breaking point. We're still able to get patients where they need to go within the time that they need to get that kind of treatment, where it's just taking a little more time and we're having to send them a little further away. But it is something we're monitoring very closely, because if we reach a point where we can't get those kinds of patients where they need to go, it could pose issues for our emergency department or our hospital. So we want to make sure we're prepared in the event that we have delays in those types of transfers. I'll move on now and speak a little bit about vaccinations. Dr. Va impressed upon all of you the importance of getting a booster dose of the COVID-19 vaccine at your earliest opportunity. Those booster doses are available on a walk-in basis at all three of our clinics, Chinle, Saley, and Pinyon. You don't need an appointment. If you completed your vaccine series more than 6 months ago with Pfizer or Moderna, or more than 2 months ago with Johnson & Johnson, come on in and get a dose of vaccine. And that booster dose can be a dose of any available vaccine. It doesn't have to be the same manufacturer that you got for your initial primary series. I completed my Pfizer vaccination back in January, and I got boosted with a Moderna vaccine this time around because that was what was available in the clinic the day that I came in for my booster. Those types of mixed dose booster vaccine series are just as effective as getting matched to the series of your primary, the manufacturer of your primary series. So don't worry about which manufacturer you get boosted with the product that's available to you locally as soon as you can. And encourage your family to come in and get boosted too. And that's available for anybody 18 years and older that's had the requisite amount of time from their primary series. We're also giving out vaccinations to children age 5 to 11 with the Pfizer vaccine. As Dr. Va reported, we've got over 1,100 children here in our service unit complete their first doses and are now starting to come in for their second doses. We have over 4,500 children in that age group in our service unit. So we still have a ways to go in terms of protecting that population. And so if there are folks out there that are hesitant to come in and get their children vaccinated, please encourage them that it's the best way to make sure our children are protected after vaccinating yourself and the other adults around them. We really want to make sure our schools are safe and stay open this winter. The best way we can do that is get as many children vaccinated against COVID-19 as we possibly can. And then finally, I also want to encourage everyone to get their flu shot at the earliest opportunity. We're starting to get the numbers of flu vaccines that we have seen in previous seasons. But if you haven't gotten your flu shot yet, please come in and do so. You can get a flu vaccine and a COVID booster at the same time at any of our clinics. It's safe, effective, and it's the best way to make sure that you're protected from illness throughout the winter months. So if you haven't done so already, please come in and do that. In terms of booster vaccines, we really do have some more work to do in terms of marketing this in our communities. As of today, only about 13% of fully vaccinated individuals in Chinle Service Unit have gotten their boosters. That compares with 20% of fully vaccinated individuals in the United States nationally have been boosted so far. So even though we did a great job of getting that primary vaccine series out and getting people protected and achieving really high vaccination rates, we haven't gotten there yet with boosters, and we may need your help in convincing people to come in and get boosted as soon as they can, so that everybody benefits from the maximum level of protection possible this winter. All right, those are all the updates that I had for today. Thank you for your time and joining this call. I'll be happy to answer any questions at the end.